Throughout the Southeast, we do tend to battle with more people who have cardiovascular disease, more people who have vascular disease in general. This is the so-called stroke belt, which has to do with problems in the brain. But the disease process is remarkably similar. You have the buildup of atherosclerotic plaque, the stuff that builds up within the arteries, and that doesn't occur just in the heart. It occurs in the carotid arteries in the neck leading up to the brain. It occurs in the brain itself. It occurs in the kidneys and the legs. So, I think people are familiar with the fact that you can have buildup of plaque anywhere in the arterial system in your body. And so if you have a population that maybe likes salt a little more than others, maybe likes a very well-prepared country ham a little more than others, who don't necessarily do as much walking each day as they should. North Carolina is historically a tobacco state.
A lot of times I see patients who have bad heart disease, and they have a lot of risk factors that led them to have heart disease, and that common risk factors are high blood pressure, diabetes. I tell all my patients there's one thing that you can do to help yourself is stopping smoking. And not only I tell my patients, but I tell them their spouse, their significant others.
Smoking is a huge killer in this country. People don't understand. They only think of lung cancer, but most of our patients don't even get that far. It's heart disease first and vascular disease first. It basically destroys the arteries in the body, and people don't understand that concept. They need to realize they worry about emphysema when really they should be more worried about the #1 killer in this country, which is cardiovascular disease. It basically causes direct damage to the inner lining of your arteries, which allows plaque to accumulate in the artery, get into the artery wall, and damage the arterial wall, which is what causes the blockages, which eventually lead to heart attacks.